Another 3 Australians have been diagnosed with the coronavirus infection, bringing the national number to 4, and authorities are expecting that number to rise. There are 3 confirmed cases in New South Wales, with 1 other case found in Melbourne yesterday. Let's get more from Lydia Fang, who is outside Westmead Hospital in Sydney. Lydia, what can you tell us about these latest cases that have been found in New South Wales?
Well, Miriam, 3 men aged 53, 43 and 35 are being treated here at Westmead Hospital. All have been isolated and are in close watch by doctors. There are also 2 other possible cases of coronavirus, which is
Another 3 Australians have been diagnosed with the coronavirus infection, bringing the national number to 4, and authorities are expecting that number to rise. There are 3 confirmed cases in New South Wales, with 1 other case found in Melbourne yesterday. Let's get more from Lydia Fang, who is outside Westmead Hospital in Sydney. Lydia, what can you tell us about these latest cases that have been found in New South Wales?
Well, Miriam, 3 men aged 53, 43 and 35 are being treated here at Westmead Hospital. All have been isolated and are in close watch by doctors. There are also 2 other possible cases of coronavirus, which is still being investigated, and we're hoping to hear results from that later today. Now, one of the men who has the deadly coronavirus arrived in Sydney from Wuhan just this week on the 20th of January. He later developed symptoms and then contacted his doctor. Another arrived in Sydney from Wuhan on the 18th of January, but it took him about a week before he fell ill, and then he presented himself to hospital. While the 3rd man arrived in Sydney on the 6th of January, but it took more than a week before he developed symptoms, and then he went to hospital, and it's believed he contracted the coronavirus after being in contact with someone from Wuhan who also had the virus. Now, authorities are contacting all the passengers on the plane from Wuhan to Sydney who were in close contact to those passengers as a precautionary measure. But the chief medical officer here says that she does not believe that the people were contagious at the time while they were on the plane, so the risk of transmission is low.
They became unwell quite a substantial period after the flight in, and so we do not believe that they're infectious at the time of their international flight. All of the cases when they arrived at the border were actually well and developed symptoms subsequent to their arrival.
And Lydia, what can you tell us about what's happening in the other states?
Yes, so yesterday we found the first case of coronavirus in Australia, and that was in Melbourne. And that man is in his 50s. He's a Chinese man, and he's currently in a stable condition in Monash Medical Centre. Meanwhile, 4 people in South Australia are undergoing precautionary tests, and those results are going to come to hand soon. There's another possible case in Queensland, and we're also waiting results from that.
Now, Lydia, with a number of possible cases still being investigated and tests underway there, as well as the news that some people have found that their symptoms don't develop until more than a week after they've had an infection, what's been the message there for the public?
Well, the advice from authorities is that people who have recently been in Wuhan or who have been in contact with somebody who has contracted the coronavirus to really monitor their health, and in particular be aware of any symptoms like fever or shortness of breath. And if those symptoms do arise, the Health Minister here in New South Wales is advising people to contact their doctor immediately or go to the emergency department of a hospital.
People who are feeling sick with the symptoms that Dr. Chant has talked about, and if you have come from Wuhan or in that area, it's important that before you go to your GP, you ring ahead and let the GP know, so that the GP can understand you're coming to be considered for that possibility, so that we can make sure that appropriate steps are taken in the GP's surgery. The GP can take appropriate steps. It's a very important aspect. And also, if you do have the symptoms, it would be great if you could also ring forward to the hospital and just indicate before you come that you're coming into our emergency department, because again, we can take the necessary precautions to make sure it's isolated, which in a 21st century capacity health system like we have, we can very easily do, but we need a little bit of warning.
The federal government has raised the travel advice for Wuhan and Hubei province given this deadly coronavirus. Now that level 4 travel warning means that Australians are not urged not to go to the region, and if they do end up in the area, it's very unlikely that they'll be able to leave, and if they want assistance from the Australian government, well, that's very limited too.